I'm going to start then with a presentation, really pulling things together. And what we've done today, what you've heard so far, is the overall case for the importance of investing in early childhood services as a mechanism for not just for increasing outcomes for children and young people, for sort of contributing to sustainable development, but also actually the importance of ECD services for social cohesion and peace building. And I think right at the beginning of this morning, Rima provided a very powerful case, an outline of the international context, and showed how our focus on ECD for peace building actually aligns very closely with the UN Sustainable Development Goals. Jim then provided a very sort of comprehensive and challenging outline of the science behind what we do. And I think one of the great things about Jim's presentation was that some of the science, I don't think we all fully understood some of the science that was there, but what we did understand, and I think when I was talking to people at break time, what people could engage with is the fact that they could see from the science how what they're doing naturally actually has scientific validity. People, and as has been said, as Jim said at the end of his presentation, people have been calling for the importance of childhood, for nurturing environments for a long time. It's in our genes to want to do that. But we haven't had the science to back it up. And I think what was really powerful is that even though it was a very sort of scientific presentation, I think we all felt empowered that actually we can do something about this. But more so now, just the science behind all of that is really pointed to the fact of what we can achieve, but also what would happen and the negative effects if we don't focus on investing in this age of the life course. So we had the overall sort of picture, politically and scientifically, and I think we've had three very powerful case studies. We could pick a whole range of different contexts, but the ones that we've looked at really have started to show you from the high level arguments about what we want to do down to the practicalities about how do we actually go about doing it, and some of the really hard issues which haven't all been solved are all ongoing, and you can see a sort of commonalities running across the presentations about the messiness and the difficulty of how do we do this in practice. And really this is where my presentation now picks things up. Because what I want to do is to share with you the work, the ongoing work that's emerging now for the Global Health Research Group. It's a very difficult one, this. We have been awarded quite a large grant for this work, but we can't announce it until after the general election, you know, PERDA and political things. So when I go through with you the plans we've got, and you might think, well, that's pretty ambitious. If I just give you a wink to say we've got funding now to take this forward, and that's why we're here. And if things were differently, the time were different, we could actually announce it today. But we'll be announcing it shortly, as soon as the general election is over. But the things that we're going to talk about, the plans that we have, there is actually resource there to help us actually in over these next few years. But what we have brought together is a truly global group of researchers and ECD specialists, and they come from very different backgrounds, with very different challenges and different contexts. But what we've done over the last 2 days here, and there's been a whole process of months leading up to this, is to start to try and develop a framework in which we can begin to approach the development of ECD services in a whole range of different contexts. And that's been a real challenge because we want to have some coherency in what we do at a high level, but as you've seen from some of the presentations on the ground, things are going to be different from one context to the next. So we've been struggling with how do we have an overall sense of what are the core ingredients, the essential elements that need to be in place for ECD to actually be effective in promoting peace building and social cohesion. But how do we define those in such a way that they are sensitive to the variety of contexts which exist? So I'm going to sort of set out shortly the framework which is emerging in that space, which we're developing, how we're intending to use it. But before I do that, I want to just start really, it's partly a recap on what you've heard this morning, but our starting point as a group. We come from diverse backgrounds, but I think we all share this as a starting point, a number of sort of key points, if you like. And it's really, I think all of us share the idea that actually these things are absolutely interconnected bi-directional arrows. They're in white, so they look great on my screen and not so great on the screen up there. But there's 3 arrows just linking these 3 things together. They're inseparable. Sustainable development, peace, and early childhood development. And I've got sort of 5 points just to sort of talk through that very briefly. And this is partly just adding to what has been said already today. But we can see the inseparability of sustainable development and peace. And Rima talked very strongly about that this morning. But it's been absolutely clearly articulated in the UN 2030 Agenda for Sustainable Development. And to quote in the preamble, it says very clearly that there can be no sustainable development without peace and no peace without sustainable development. And we know that poverty, inequalities are key drivers, maybe the main driver of civil disorder and conflict. And we also know that conflicts, that armed violence actually intensifies poverty. So there's an absolute connection there. I don't think anybody is disagreeing with that, but we have to understand that. And the research backs this up. And we can see, for example, that if you look at those countries that have experienced major violence, they have extreme poverty rates 21 percentage points higher than other countries, similar countries without violence. So there is a clear relationship between the two, and they exacerbate one another. It's also been estimated that about 1/3 of the total global population living in extreme poverty are also living in fragile states. So I think we understand that picture, that those 2 boxes at the top, the interconnections there are absolutely deep. But secondly, we know very much now about the impact of poverty on children and children's development. So we know, for example, that 250 million children, about nearly half of children aged under 5 living in low and middle income countries, are at risk of not achieving their developmental potential. We also know that these developmental deficits start from birth, if not before, and just increase and exacerbate over the lifespan. So they're carried through into youth and adulthood. So we know there's a very clear impact of poverty on child development. There's also an impact of violence on children and children's development. And we're well aware, and it was talked to very sort of strongly by Jim in his presentation about intergenerational nature of violence. And we have growing evidence of just how living in divided societies, living with the trauma and the fear and the prejudice is something which actually imprints itself in your makeup and is passed on from one generation to the next. And we know that from a whole range of different research. There's research in Israel and Palestine, for example, it shows that children at the age of 2 are already aware of the other, of Arabs, of Israelis. We know also that from the age of 2 to 3 onwards, they can develop negative stereotypes about the other and a fear for the other, which then kicks all of those genetic biological processes that Jim was talking about earlier from a very early age. Here in Northern Ireland, the research we've done, you've heard a little bit about it already, but we've found exactly the same process at the age of 2 or 3. But we also found that by the age of 6, about 1/3 of children are clearly identifying with one community or the other, in terms of the 2 main ethno-religious communities here, Catholic and Protestant. And 1 in 6 children, we estimate, at the very least, an underestimation, are making prejudiced sectarian statements about the other community. So we know that violence impacts upon children's development. But we also know that these arrows are bidirectional, that child development is impacted upon by poverty, it's impacted upon by violence, but child development, if we invest in it, we are developing the evidence base now to show that it can actually have impacts positively the other way. So there's as mentioned earlier, the famous Heckman Equation, based upon research in the sort of global north in America, but showing that for every $1 that's invested in high quality early education, it brings a return to society, and the estimates differ, but around $8 in return. So there's an economic argument. The more we invest in early childhood, the more that we see the positive outcomes at an early age being carried forward into adulthood, in terms of more healthy adults, more educated adults, more employable adults. And that has an impact positively on society. But we are also now starting to gather evidence that this is also the case in lower and middle income countries. There's a 20-year study that Heckman did with colleagues in Jamaica, which looked at the impact of family support schemes for parents of children who have stunted development. And what that's shown is that after 20 years, those that had the family support, going back 20 years previously, now as adults, that their annual earnings is 25% higher than those that didn't have that support. And that the gap between those who were experienced stunted development at an early age and those that were not had disappeared. So there is growing evidence now that the same type of investment in early childhood in low and middle income countries can have that positive impact back on sustainable development, can be one of the drivers of pushing for sustainable development. But we also know, and I think this is the focus for today, that we can do more than that ECD services can have a direct impact upon peace and peace building. And we can see that in two ways. There's the obvious way, and we've seen that partly this morning in some of the presentations, that we can help children develop clear peace-building skills, an empathy for others, a respect for diversity, an understanding and awareness of those around them. They can also develop, even from a very early age, the beginnings of conflict resolution skills, which they can take forward and build upon as they progress into middle childhood and beyond. But we also, and I think this is the most powerful point, it's not just about the development of the children themselves, but it's how that has an impact upon people around them, upon families, upon communities. And we've seen absolutely clearly with our evidence here in Northern Ireland, with the major initiative, we've seen Liliana and the evidence from Serbia and so on, that actually we adults that are involved in early childhood programmes of the type we've been discussing, you can actually see positive outcomes for them as well. A greater awareness of diversity, a greater willingness and self-efficacy, confidence that they can make a difference. I think one of the most powerful things when we were doing our first pilot of the major initiative, going back longer than I want to imagine now, 2003, and we had some conversations with some of the pilot settings, and they were a bit nervous. And this is the bit about the media. The media messages were very important because they showed the general population, the communities, that actually this isn't something to fear. You know, they were hearing about a preschool programme looking at sectarianism, and you can imagine that's a very scary, concerning thing to a parent. What are you teaching my young children? But when they saw the cartoons, they saw the media, they saw that this was a very inclusive, positive, age-appropriate programme. But one of the most powerful things that I remember, we're talking to some of the parents who were very honest at that point, and they said to me that actually this type of programme, they're too old, they're past this, they don't feel that their attitudes are going to change. In fact, some of them said, I don't want my attitudes to change. I've seen things, I've had experiences of people being killed or hurt, and I can't forgive. You know, whatever else, I'm not in a position to move on. But what I don't want is my children to have that experience. I want them to be different. And I will go through this programme for the sake of my children. I might not be able to change, but I will do it for my children. And that's something, the power of early childhood was captured in that essence. And of course, the great thing is we know that people who openly commit to and engage in programmes like this, they do change. But in a safe way, in a way that which is in what they're in control of doing. So I think what unites us is very different contexts. We're talking about a global network, very different situations. But it's this sort of three multi-directional, embedded, inseparable nature of sustainable development, peace and early childhood. So with that sort of clearly in mind, what I'd like to do now is just to say a little bit about who we are and then what we want to achieve as a sort of a research network, and then our framework and plans going forward. And then, as I said, we'll have a 5-minute comfort break when I've finished there, but this is really just our starting point. So we'd be really keen to get people's views on how that feels, but also from the presenters this morning, the chance for them to say a little bit about how they think about this framework, the challenges they feel they're going to face when we try to implement it, but also just general open discussion for this. But who we are. So, the funder's name will be on this title at some point, but at the moment we're a global health research group on early childhood development for Peacebuilding. We are a global network of researchers supported by ourselves here at Queen's, by our colleagues at Yale, NYU and Harvard, working in strategic partnership with UNICEF, not just UNICEF HQ in New York, but UNICEF country offices in the countries that we're going to be partnering with, which I'll outline very shortly. And although the universities listed here are the ones who are supporting this network, we want to be absolutely clear that this is a global network. When we get a website going, we'll have all of the universities listed from the countries that we're working with. This is not a sort of a global north, small elite group of universities telling the rest of the world how it should be doing things. It really is a genuine partnership, and all of the services which get developed, all the things we want to do have to be led by people in the countries where we're working. Our research network will be, the research group will be affiliated with the Early Childhood Peace Consortium, and there's meetings for the rest of this week where we'll be looking at just how the detail of that, but we want this network to be actually embedded within and linked to and supporting the broader work of the ECPC. And what we want to do more than anything then, and what we have funding to do, is to work with and support key stakeholders, communities, organisations on the ground in a number of low and middle income countries to help support them, to provide research capacity building and training and to build a research programme around the early childhood services that they want to develop. So it really is going to be led by a number of countries. They're going to tell us what are the priorities for them. They're going to identify for us what they want to do. And then we can build a research programme. Research teams which involve researchers locally from those countries with support from ourselves. And it's that type of collaboration which we want to take forward. The 6 countries which we're going to, in our first phase, develop work in are listed here. Kyrgyzstan, Tajikistan, Vietnam, Timor-Leste, Egypt and Mali. Of course, the question is why those 6? Why not another 6? And there's not an answer. Whichever 6 you pick. There is an answer this time. Those are the 6 countries where UNICEF have funding in different sources to actually fund early childhood services. So when we bid for a larger grant to support the research and capacity building and the networking around this, we were able to say that actually the services have funding already. So we need funding now to support the research part to it. So it's partly just opportunity of what funding is available and the timing of it. But these are the first 6 countries, and we're very keen from the beginning to start tying in 3 or 4 more countries, not where we're going to be able to support ECD services straight away, but where there may be researchers in those countries who have resource to be able to join our research network and who we can then support to bid for funding. And I think the point made earlier about local funding, engagement with local funders and organisations and governments is critical in all of this. And one of our plans is we have to show that this is a sustainable network. So we're not just a 3-year project where we'll do the research around individual services and then stop. Right from the beginning, we need to be thinking about impact, about advocacy work within countries and then internationally, and we need to be thinking about further funding and sustainability of what we do. Not just within the 6 countries here, but also then in terms of expanding our network. In terms of our programme of work, there's a number of things that we've said that we're going to do. Obviously, to develop a global research network, we have funding to bring together 3 researchers from each of the 6 countries that you've seen. So there's a core network of 18 researchers from those countries, those partner countries. We have the funding to bring them together twice a year, but also to provide ongoing training and support and technical expertise as they need. And actually there's a whole range, as we've met twice now over these last couple of days, and there's already huge expertise amongst the researchers. Some are epidemiologists trained, some are teacher trained in terms of education, some are psychologists. So already it's going to be a network where we support each other. It's not going to be a one-directional area of support. But we're going to bring and create and sustain that network to help build research capacity within and between countries and with ourselves. We also then have a focus on helping to support the development of ECD services, their piloting and evaluation. And we're very clear that, as you've seen already, and some of the lessons are, let's start small, let's do something small where we can be effective. But let's be clear about why we're doing it, what is the evidence base around why we're focusing on this and not this. Now, the evidence may already exist in some countries, it may not in others. So our starting point in some countries may be baseline research, qualitative research to identify what the issues are that need to be addressed. And then we may move on to developing initial services and piloting them in a very small scale, seeing how they work, maybe evaluating it with qualitative designs to get the experiences of those involved, to tweak what goes on, and then to take it to a sort of a larger scale. We won't get everything finished in 3 years, but we can have a starting point, and hopefully, if we can see positive results coming through, that's a starting point for further funding and support to take those services forward further. And alongside actually developing services in the 6 countries and using that as a way, it's probably the best way to actually develop research capacity is to work on live projects. There is, as I've mentioned, a focus on advocacy. Advocacy work within countries and internationally. So within each country, we want to develop an advocacy strategy. We have funding for seminars, for events, for engagements with NGOs, with government departments, ministries, if that's appropriate. So it's really, again, led by people in country, but the support for us to bring to bear the wider network to help the advocacy campaigns within each country. But also there's a huge opportunity, and I think you're picking it up today, about how we can learn across our different countries and the sort of broader lessons in terms of how we do this. So we want to sort of pull that learning together as well. And there's still work to be done in terms of UN resolutions and so on, but I think we're up for it, we're ambitious, and I think the tide is right for us to really push now on this. But there needs to be an evidence base, as Rima said right at the start of the day, and that's what we're here for. And then moving forward, more broadly, we want to grow the network, increase the number of countries involved. We want to develop open access tools and resources for researchers to use, freely available in countries, training materials, measurement instruments and so on that can be used and adapted and guidance provided so that anybody can pick those up and begin to use them and hopefully then link into the network and share the information and the evidence that they're creating. And of course, ultimately, as I mentioned, we want to build a strong and robust international evidence base. I think we all know, and the science is there, we all know that investment in early childhood can lead to long-term positive outcomes for society, for peace building. But the actual evidence right now in terms of the causal connections from one little step to the next isn't fully there. So we need to build that evidence base. And what is really exciting is the potential with a whole range of countries contributing that we can over time start to build up a wealth of primary studies in a range of countries, adopting very different approaches, different types of ECD service, from parenting programs, community-based initiatives to setting-based work. And when we start pooling all that together, we can ask some really interesting questions and about, well, what seems to work, in what contexts, for which groups, at what times, and what works better, and for what age groups compared to others. And we can start to do what's called meta-analysis, pooling all that data together. So, how do we intend to do all of this? This takes us on to the framework. You'd be pleased to know there's only 2. This is the second of the last slides. There's a fair bit of talking around them, mind you, so keep in there. But that's what we want to do. There's ambition around our work in partnership with countries, developing ECD services, creating an evidence base, having open access tools and resources. But how do we want to do that? Well, what we've been working on, and it still hasn't been finalised, I'm going to talk you through it on the last slide, but we're working on development of a measurement framework, a framework for evaluating the impact of ECD services for peace building. And we want this framework to do 4 things. We want it to be an advocacy tool. We want to be able to publish it and disseminate it in such a format that it provides a very clear theory of change. For those of you here today who may have seen the title of this conference, not had involvement in ECD and peace building before, I'm sure your first question was, well, that sounds really interesting, but how? How does the link from parenting programmes work its way up to national peace building initiatives? What are the causal links from there to there? We believe that there are strong causal links. There is a theory of change, and what we want to do with our measurement framework is to set out that theory of change, to explain it, to explain the evidence that's behind it at the moment, to identify where there's evidence gaps or limitations that we need to find, but certainly to set out very clearly as an advocacy tool. Different languages, different formats to be used in different countries, but a clear statement of how ECD programmes can lead to peace building. Secondly, we want this measurement tool, this theory of change, to provide guidance for those who are able to invest in ECD services. In some countries that will be governments, ministries. In others it will be NGOs, civil societies, other funders. But whoever it is, if they're being convinced by our theory of change, the next question will be, well, you guide it. Where should we intervene? And we've got the idea, it makes sense to us, but what should we look at? If we've got funding for 3 or 4 ECD services, what should they be? What should they be doing? And taken together, what should they be doing as a sort of a system in this regional context or local context? And what we hope is that the framework we develop can provide that type of high-level guidance, identifying the key essential ingredients that need to be in place at each level of the process, from investment to the design of services to the delivery of them to the outcomes that they're focusing on, that will help investors to see what the big picture is and coordinate the services that they invest in. Thirdly, we want the framework to be able to provide support to people on the ground who may have funding or may have resources or may just be a community-based initiative who want to do something, but want to do it effectively and want to be sure that they've got the best chance to be achieving impact in what they do. So they want help in terms of, well, how do we go about designing the programme? How do we think about our theory of change for our particular programme? So we want something, a framework which may be a high level to start with, but then can be adapted and changed so that people on the ground, if they're here in Belfast or Nairobi or anywhere else, they can sit down and say, well, this is our context, this is our situation, this is the particular element we can make a difference in, and use this framework to actually map out what are the outcomes they want to focus on. And if those are the outcomes which are important in that context, what are the activities, the services that need to be in place to achieve them? And what are the investments needed? And how do we develop these in a conflict-sensitive way? So thirdly then, it should be a framework that provides practical support. And then fourthly, a framework which allows for robust evaluation. So that we have a framework which allows researchers then to be able to evaluate the impact of the services being developed and delivered. And the evaluations will take different formats. Some will be focused on qualitatively, what's gone on in this context? What are the processes? How is it received? How can we understand people's engagement or not in this? But also quantitative, trials and other formats where we can measure impact over time. And it's through that we can start developing and building an international evidence base. So, I've used this joke before, but it's the only one I have. But before we started this process, I used to have a full head of hair, and you can see that the stress involved in trying to develop a framework that achieves these 4 things has been immense. So my hair is receding fastly. And we haven't reached it yet, and I think we started on Monday morning. We've developed drafts of this. We've gone through many months, gone through getting feedback virtually. We've had many Skype calls, many discussions. We had a draft which people read and provided comments on before they arrived here in Belfast. We've had 2 days of intense debate and scrutiny of that draft. there's now a long list that Laura will be working on. Well, we'll be working on together as a team, trying to capture the key themes to do a new version of the framework. But what we've said from the outset is this is a long-term process. We're not going to have a framework sorted and finished and stamped in 2 weeks or even in a year. This is a lifelong process. It's going to be adapted and changed as we get more and more experience and input from people. But we have to start somewhere. So how are we starting out? This is the last slide. This is what the framework looks like broadly. There's a whole narrative around it, a narrative which explains the importance of early childhood, around the science behind what we're doing. But ultimately, at the heart of our framework is a logic model. For those familiar with logic models, you can see it's a classic one from investments, activities, outputs, outcomes, and we've got assumptions, external factors that are there. But what we're trying to capture here, and this has been the difficulty, is we're trying to say, well, if we're thinking about ECD services, not just high quality services carrying on as normal, because we know that those on their own won't achieve peace building, but what needs to be in place for ECD services to actually contribute not just to sustainable development, but to social cohesion and peace building. And here's the big question: what are the essential elements, the essential ingredients at each stage in the process that need to be in place for us to have the best hope that what we do will be effective? So, what you can see here then, and the final framework it'll be on a page. There'll be bullet points which will, in each of these columns, which will be the essential ingredients. I'll give you examples of ones which we're discussing at the moment, but it'll give you an idea. And this will be the framework. This will be the ones that we ask governments and NGOs to look at, to say, in terms of ECD for peace building, if you're interested in this area, this is the overall map of change and theory of change. If you can invest in 2 or 3 services, can you see how you can fit them into this map? And for individuals developing services, they're not going to be, no service will achieve all of this, but they'll be able to work their way through and identify what are the outcomes that they can achieve, and then work their way backwards in terms of the things that need to be in place to get there. But just to talk through this, in the first column then, investments, this is really about the way in which governments, funders, NGOs invest in early childhood services. It's not good enough just that money's provided. So there needs to be, and this is a statement about what needs to be in place. It may well not be what's in place right now. And we had a good discussion that actually some of these things, they're here right at the start of the process as investments, they could in the end become outcomes. So the outcome of all of this could be in 5 years, we have a national ECD policy for a country. And that suddenly then is the starting point. But that is a big outcome at the same time. So you can see the complexity. This is a linear thing, and it's not linear. It's a circular process. But we have to start somewhere. And what we see here is that, there's certain characteristics that have to be in place if we're going to be about peace building. So ECD, there should be national policies in place, but those national policies need to recognise the divisions that exist in that particular society. Need to engage with them and adapt the policies to address them in a meaningful and sensitive way. There needs to be ECD policies and investments which are inclusive in how they've been put together, which reflect the needs and voices of the communities in a country. And here's one of the risks that you develop an ECD service, and if you're not sensitive to the context in which you're developing it, and you develop it for one community and not another community, or there's any sense of bias in what you're doing, that can be a massive risk to peace building, never mind the ECD service itself. So there's a whole range of particular criteria, key elements that need to be in place that will inform how investors, governments, other funders should approach investment in ECD services. So we want to capture those. Then with the investments in place, you've got activities. What we mean by activities in this sense is the development of the programmes themselves, the design and development of ECD services. And again, if we're really about peace building, It's not just about improving outcomes for children and their primary carers, for example. It's about the opportunities for being a vehicle for change. The community is actually being pulled together, working together, finding common ground where it's possible and appropriate. So in all of what we do, you can imagine some of the key ingredients here under activities will be things like the real meaningful engagement of local communities, the co-production and design of new services. Services that bring communities together or people from across political divides together. And services which are explicitly recognise difference, recognise the conflicts that exist, and have some way appropriate to the local context of addressing those. So you can see when I'm describing these are all very high level. And then on the ground in a particular country or context, it's a starting point for people locally to think, well, what does that mean for us? And for sometimes it may not be applicable, but in other times it will be, well, what does it mean for us in practice? How do we do this? What are the divisions in our context? Who do we have to make sure that we're inclusive with? So that's a second column then about what we need to identify essential ingredients for the design and development of services. And then outputs, what we mean by this are the services themselves. So ECD services. And again, they reflect a wide variety of anything to do with creating nurturing and caring environments for young children is an ECD service. So that could be a service focused on supporting parents. But it could be a service based in a preschool setting. So it's a whole range of different approaches, community-based work. But whatever that service is, again, we need to identify what are the core ingredients that need to be in place. And some of them are obvious, but they need to be provided on an inclusive basis. They can't just be provided for one community compared to another. They have to be provided on an equitable basis. They need to be high quality and holistic in their approach to child development. They need to be culturally sensitive. They need to reflect diversity at the core of what they do. And where appropriate, they need to be proactive in addressing divisions and prejudices. And we've seen some examples of how we've been trying to do that with some programmes already. And again, there's going to be more. This is what we're struggling with right now. What are those core ingredients that should be in place? And then direct outcomes. These are the ones which we can believe and have confidence that those services will actually achieve impact directly. So a lot of these will be impacts on the children and their development directly, but also impacts on adults that are involved. And we've seen some really important examples of the impacts for parents and caregivers more broadly, the impact on early childhood professionals working in settings. But again, you can imagine what we want to do is it's not just holistic child development, important though that is, but we want to see peace-building skills. We want to see that children, for example, essential elements will include children developing an understanding and respect for diversity, developing empathy, developing conflict resolution skills. All of these are going to be age appropriate, so you can imagine for each of the bullet points we're going to have to then specify what that looks like for a 0 to 3 year old, for a 3 to 5 year old, so we're going to have to do all of that. But I think there's a fair amount of consensus, and we're still working with all the detail, but a fair amount of consensus that whatever the context, there are some core things that we think should be in place in terms of high quality ECD programmes that don't just lead to sustainable development, but also lead to peace building and social cohesion. And then there's a longer term, the sustained outcomes. What we believe that will follow and flow from the direct impacts of our individual ECD services. So in terms of impacts upon children's development, what we know already is that should lead to increased health, increased well-being, increased educational performance and attainment, increased employability, reductions in aggression and crime. We know these things from many studies, many of them in the sort of global north, but an increasing number now in low and middle income countries. So this is what we mean by the sustained outcomes. But we also, and where we have less evidence, but we need to gather it, is to show that when we do develop ECD programmes on a community basis, where people do work together, that some of the really positive stories that we've heard, before lunchtime, that they actually are sustained, that they are carried on, that there's the sort of the paying forward approach, that the more positive attitudes and relationships that individuals develop actually then flow through to others in their sphere of influence, in their families and communities. So we need to capture that information. But that is our theory of change. So you can see how we're starting right from the beginning of investments, working our way right the way through to the design, the delivery, of services, the direct impacts, and then the longer term sustained impacts, which is where for those that started today, that's where we would see what would be more recognisable as peace building and sustainable development and social cohesion. But of course, if anything was ever as simple as that, and it's not, because right across the bottom, and this is a big challenge for us now, to how do we develop a model where we really do take the bottom bit seriously, because that is the all-important bit. We have to be clear about the assumptions in our models, and some of the assumptions won't work. And in some countries, actually, the government is the problem. I have to be honest about that. So it's not a force for good in certain contexts, or it's not seen as such. So there's assumptions there about, well, who is the investor? Who is going to help to lead this, take this forward? There's assumptions about the delivery of the services, that they are inclusive and universal, that they are delivered with fidelity. We've seen these before. So there's a whole range of assumptions that we need to recognise and put into the model and to monitor. Critically, there's external factors and risks. Governments change, societies collapse, environmental hazards happen, a whole range of things which are just not foreseeable, and others which are. And the political processes, we're in a general election here, a couple of other people have talked about elections happening right now as well. Things can just change like that very quickly. And we've mentioned already that ECD services themselves can be significant risks if they're developed without a conflict-sensitive lens. If they're just imported, they can actually add to divisions, exacerbate tensions. So we have to be really careful about all of that. So, next steps. Oh, I lied. That's a negative word. There is one more slide. It wasn't on my thing there, but this last slide is this next steps. This is really the last one. What we're going to do now for the next 6 months as we start to work into at least a 3-year programme of work, well, we need to finalise this measurement framework in its current format. You've seen how it would look as a graphically. It's going to be made up of bullet points, which, as best we can say right now with the global expertise we pulled together, those are the key ingredients at each level which need to be in place. How they look for each context will be different, but those are our high-level map of our theory of change. So we want to have that finished, have that published in different formats, academic journals, also books, and a whole range of formats. So we make it accessible to different audiences. So that's something, as an advocacy tool, we want to get out there. We then want to pilot the measurement framework. We've got 6 countries we're working with now. The main priority is capacity building and developing and delivering ECD services. But while we're doing that, we've got this framework. Let's see how it works in practice. Let's see if it makes sense to the people we're working with on the ground. What we've said are essential, are they actually essential on the ground in different countries and contexts? And that's why this is a lifetime's work, because it's going to change absolutely once we try and use it in practice. We want to thirdly develop a website, want to develop an interactive version of the logic model. And this is that part about support. If you can imagine then, really that as a model as a whole is just an overall high-level framework with bullet points of the essential ingredients. And then for somebody individually, as a team, developing an ECD service, they can start with that. If we can get an interactive model that they can then adapt. They can identify of all the outcomes, our service will only address these 3. So they can just click and make the other ones disappear. They can then track backwards through the logic model to identify the bits that need to be in place to get to the outcomes they're interested in. And then they can fill in the detail. So whereas we might say that one of the essential ingredients is local community participation, there's the opportunity then to actually fill that in. What does that mean in a local context? Which communities, which groups, and in what way? what are the methods of participation. So you actually fill in the detail. And so what we have from a high-level model, it's interactive and can produce then a bespoke logic model for a particular service. And then fifth, we want to, fourth, yes, yeah, I'm on four and five sort of merge together, but we want to then create an online repository. So you can imagine then, in terms of evaluation, there's going to be a whole range of outcomes. We need to find measures which are suitable. There's many that exist already which can be used, but we've heard today that there are many more outcomes in particular countries and contexts where there's no measures that are suitable at the moment, where measures need to be adapted. And I think that's going to be actually the story of what our work for the next 5 or 10 years, is that in many of our evaluations we're going to have to develop new measures or adapt existing ones. They're not going to be relevant. But what we want to do is to create a global resource, an online open access free resource where we capture those measures. My own area, looking at young children and prejudice, it's really exciting to see that some of the measures we had to develop for Northern Ireland are being adapted and developed differently in different countries. It'd be great to see all of those uploaded and available. And we can provide information on the measures, on their validity, reliability, where they were used, for which countries and which contexts and what age groups. And then fifth, which sort of follows on and links all of this together, is an open access method then for developing measures and tools for evaluation. And we're delighted to be working with Harvard Humanitarian Initiative and Kobo Toolbox. If you've not seen it, you should Google Kobo Toolbox. The basic idea is that ultimately we can have our measurement framework, our logic model, people can go through, adapt it, identify the outcomes they're interested in, and then click through from there to a whole database of existing measures. They can pick the measures, instruments that they want to use for their particular evaluation. Those will all be available in Kobo Toolbox. So you then click through to there, you pick the tools that you want, you move them around in the order that you want them in, you press a few buttons, and you've actually got an online research instrument, which can then be used directly on mobile phones, on tablets for data collection in country. And it's a terrific resource that's there, which then uploads that data that we've started, even we're catching up now in Northern Ireland. We've got so many iPads and things around. So, I mean, it's a great way of capturing data efficiently, effectively and safely. So we hope that that can be a real tool from the beginning of designing a service to designing the evaluation to working your right way through to developing the research instruments. So as I mentioned, that we're not short on ambition in terms of what we want to do. But I think if ever we've got the people in the room, and not just in the room, but in our broader networks, we certainly have here in the Early Childhood Peace Consortium, in the research group that we've pulled together here, not just in terms of research, but in terms of practice, in terms of the experience across a range of different countries. So thank you very much.